Hello, everyone. Dr. Van Merkel here with Science-Based Nutrition. We got a great case here for you today. It's going to be just a quick one here. And we have cases like this all the time. I have so many more, but I get a little distracted. I get caught up in things. I don't really report all that we see. But if you go back and look we've had some amazing cases here in our clinic as well as other SBN members around the country. And if you get a great one, don't hesitate to let us know because we'd love to share it with everybody else. But here we have a 62-year-old male, 5'10", weighs about 185 pounds, and he presents with some prostate issues. And here's his lab work. Now here's his first test, and nothing major shows up here. Again, nothing critical that we see. There's a few problems, but then we go on down and we see there's the PSA. Let me move it on up here. There's the PSA of 8.7. And we'd like to see it at least below 4, if not around 2 or less. His is 8.7. And so that is a very questionable area. That's not good. And he decided to delay a biopsy until we see what we can do. But he's having no symptoms, but the PSA is high. And so we put him on a special program. You see we started him in January 8th of 2020. And then on May, now there was a partial test in here too. But by May, it had dropped from 8.7 all the way down to 3.8. Yes. No chemo, no radiation, no surgery, no biopsy, but it dropped very nicely, 8.7 to 3.8. Now, what would you tell this patient? Keep doing what you're doing. It's working. Absolutely. Now, I'm not saying that there wasn't any cancer. I'm just saying the prostate is healthier. Could we all agree with that? That an 8.7 dropped down to 3.8, prostate's healthier. Now, one of the things we also do, and you all know that, we did, I'm going to move this out of the picture here so you don't see the patient's name. And we do a hair test. And let me get his name out of the way. And look at his hair test. No heavy metals show up. None. Is that a bad sign? That's a bad sign. His body's not getting rid of it because I guarantee you, in our culture, in our community, in our environment today, we are being exposed to heavy metals. We are being exposed to toxins. But it's a bad sign if they're not showing up in the hair, isn't it? Yeah, his body's not healthy enough to get rid of them. So that is bad. So what do we do when we see nothing show up in the hair? Yes, we do a DMSA. The urinary challenge is what's recommended. And you can see when he did just the first collect 6 hours of urine, 110, some gadolinium showed up. I'm not sure why that did, but no lead or mercury and not much else. But then we used a little DMSA, just 1,200 milligrams. Look, we see screaming, extremely high levels of lead coming out and other things too. So as I've told you before, if you see high levels of toxic elements that aren't coming out the hair and they're not coming out the urine, they are accumulating and getting higher levels in your body. Those higher levels will affect your immune system. It'll it will overburden your immune system, make you more susceptible to other problems. So he's been on oral chelation. Yes, DMSA, which he is buying himself online. It is now available online, everybody. The COVID crisis is over and the borders are open now, and DMSA is available. So I'm sure you can Google it and find it just like we do and our patients do. And so we help them, we guide them on how to use it safely and properly. And this is a good example of the results that we're getting by guiding people, not just on DMSA, but also on their diet and their other vitamins. And you can get results like this too. I love it when doctors send me notes and say, hey, did you see this patient? That kind of thing. And a lot of times we'll talk about it here, but if we can do it, other doctors can do it, you can do it too. You just got to go out there and start working it. Let people know what you do. This is a great time with the COVID-19. People don't have insurance. Their medical doctors are busy. There's right now about 18% fewer medical doctors than before COVID. They've gone out of business. Great opportunity for you. Your patients that you're seeing that need adjusted, they need this stuff at least as much, if not more, than an adjustment. It'll also help COVID-proof your practice, just like you did with ours. So there's a great case. Hopefully that charges you up, gets you excited, and you can do this work too. Have a great day. I'm Dr. Merkel.